not fear-mongering to be like, hey, did you know that fetal alcohol spectrum disorder tends to overlap with symptoms of ADHD? Not fear-mongering to be like, hey, if you know that your birth parent drank alcohol while pregnant, it might be really beneficial to look into FASD. It's also not harmful to be like, hey, there is a correlation between prenatal alcohol exposure and FASD and ADHD. The behavior profiles of children with FASD include difficulty with executive functioning, memory, planning, processing speed, and attention. Although attention deficit hyperactive disorder is diagnosed in up to 94% of individuals with heavy prenatal alcohol exposure. The exact relationship between FASD and ADHD is unclear. There is some evidence that ADHD and FASD may be a specific clinical subtype and thus may require a different treatment approach, although traditional behavioral observation scales may not distinguish between the two groups. There is evidence that children with FASD have a different profile on the 4-factor models of attention than children with ADHD who do not have FASD. This one also says ADHD is the most common reported mental health diagnosis in individuals with prenatal alcohol exposure. The prevalence of ADHD in children with heavy prenatal alcohol exposure is between 49.4% and 94%. Unfortunately, prevalent studies have included children with heavy prenatal alcohol exposure with and without diagnosis of FASD, hence the wide prevalence range. However, the prevalence of ADHD in coherence with FASD is consistent with much higher than that in the general population. The population with children with a diagnosis of ADHD who also have FASD is not known and will be influenced by undiagnosis of FASD. Undiagnosis occurs due to a variety of factors including health professionals' reluctance to ask about alcohol exposure in pregnancy or to make diagnosing due to lack of knowledge or fear of stigmatizing the child. The proportion of children with FAS diagnosis with ADHD increases with the level of alcohol exposure. All I'm saying is like, hey, if you know your parent drank alcohol while pregnant, you might want to look into FASD. If you know for a fact your parent didn't drink alcohol while pregnant, then that video wasn't for you and you don't have FASD. That is all. Bye.